All right, let's jump right into this. Today, we're going to tackle a really common belief about medicine and getting older. And it's a belief that a fascinating new study is basically turning on its head.
It's a question that really weighs on patients and their families. Is there a cutoff point? A moment where the number on your birth certificate just makes a big operation too risky, even if it could give you your life back? Well, that's the exact assumption we're going to put under the microscope today.
So to really get what's at stake here, we need to talk about the ankle. For millions of people out there with severe ankle arthritis, the simplest things, walking the dog, a trip to the grocery store, they become these massive, painful struggles. It can absolutely crush a person's quality of life.
But thankfully, there is a pretty incredible surgical fix. It's called Total Ankle Arthroplasty, or TA for short. The easiest way to think about it is like a hip or knee replacement, but for your ankle. A surgeon goes in, removes that damaged, painful joint, and puts in this high-tech artificial implant that's designed to bring back pain-free movement.
Now, this is where it gets really interesting. How people end up needing this surgery in the first place. You've got younger patients who often get arthritis because of an old injury, right? A bad break, a nasty sprain from years ago. That's called post-traumatic arthritis. But then you have older patients, and for them, it's usually just degenerative arthritis, the result of a lifetime of normal wear and tear. So right away, you have two pretty different groups of people, which is the perfect setup for a study.
And that brings us right back to the big question. Does your age actually change how well you're going to recover from this major surgery? Well, a team of researchers decided to stop guessing and actually dig into the data to find out for real.
And listen, this was not some small little study. They looked at the outcomes for over 1,000 patients, 1,075 to be exact, who all had this ankle replacement surgery. That is a huge sample size, which gives their findings a whole lot of credibility. And they made sure to look at everybody. The study wasn't just focused on one group. It included patients from right across the adult age spectrum. We're talking people under 50, all the way up to folks 70 and older. Having that wide range was absolutely essential for making a fair comparison.
Okay, so how do you even figure out if a surgery was a success? Well, these researchers were super thorough. They honed in on the things that really matter, both to the doctors and, maybe more importantly, to the patients themselves.
Yeah, they looked at this from all sides. They tracked the immediate stuff, how long you're in the hospital, and if you had any complications that brought you back, but they also tracked the human side of it. How fast did people get back to their normal lives? And the big one, how did the patients actually feel about the whole thing afterward?
Okay, you're going to want to hear this because this is the part where that conventional wisdom just starts to crumble. The data revealed a picture that honestly surprised even the researchers and completely upends what we thought we knew about age and surgery.
First, let's look at the one thing that pretty much went as expected. Older patients did stay in the hospital a little bit longer, but look at these numbers. We are talking about a difference of less than one single day. So, is it statistically significant? Sure. Is it some major real-world problem? Not at all.
A slightly longer hospital stay? That kind of makes sense. But that is nowhere near the whole story. So the really important question is, what happened after they went home? What about the things that actually define whether a recovery was a success or not?
And here is surprise number one. When they looked at serious complications, the kind of stuff that sends you back to the hospital, age made no difference. Zero. The risk for someone who was 75 was statistically the same as for someone who was 45.
Okay, what about the ultimate failure, needing a whole second surgery to fix the first one? Again, the data was just crystal clear. A person's age had no significant impact here either.
And the recovery itself? The time it took for people to get back on their feet and start living their lives again? Totally comparable, right across the board. Older patients didn't take any longer to heal up and get moving.
Look, clinical data is one thing. It's numbers on a page, but it doesn't tell the whole story. The biggest question of all might just be, were the patients happy? Did they feel like it was all worth it?
You don't have to take my word for it. The study's own authors summed it up perfectly. They found that the patient-reported outcomes, basically how people felt about their pain and their ability to function a year later, were just as positive for everyone. This tells us that the older adults were just as thrilled with their new ankles as the younger folks were.
So what's the big takeaway here? When you step back and look at all these pieces together, the verdict on age becomes incredibly clear, and it has massive implications for how we should think about this kind of surgery from now on.
So let's just boil it all down. This study found that when you look at what really counts,
avoiding complications, recovering well, and actually being happy with the result, a patient's age just wasn't the big scary factor we thought it was. The evidence is right there. This surgery is a safe, effective choice for all adults. It completely challenges that outdated idea that you can be too old to get your life back.
It's just a powerful reminder that we should always be questioning our assumptions and just follow the data where it leads. It really makes you wonder, doesn't it? If a number on a birth certificate can't predict success for a major joint replacement, what other medical beliefs that we've held for years are ready to be challenged next?